Senate Parliamentary Secretary, Mr. Amrin Amin.
Mr. Chairman, I will focus on three areas: removing artificial trans fat from our food supply, reducing smoking rates, and third, strengthening our health ecosystem. On the first area, artificial trans fat is harmful to health. According to the World Health Organization, artificial trans fat increases risks of heart disease and has no known health benefits. WHO has called for countries to remove artificial trans fat from the food supply. Currently, our law requires food manufacturers to declare and limit the amount of trans fat in cooking oil and fats. Local trans fat intake halved from about 2 grams per day in 2010 to 1 gram per day in 2018. It is timely to build on this. We will be introducing a ban on partially hydrogenated oil or PHO in our food. Current trans fat regulation only applies to fats and oil. This ban will also extend to prepackaged food products such as snacks, baked foods, prepared meals, and fat spread. PHO is a major source of artificial trans fat in this food. Banning PHO should not have an adverse effect on Singaporeans' food options and cost. MOH has consulted the local food industry, who are generally supportive. United States, Canada, and Thailand have also banned PHO. The industry will be given time to make adjustments. Details will be shared subsequently. Mr. Chairman, turning to second area, reducing smoking rates. Dr. Chia asked about efforts to help smokers quit. Smoking remains a concern in Singapore. I had announced in May 2018 that we are working towards a smoking prevalence of less than 10% by 2020. There are about 400,000 daily smokers today. 1 in 6 smokers tell us that they are thinking about quitting, but only 3 in 100 smokers actually take action. We target to get more smokers to go beyond thinking about quitting to actually take active steps to quit smoking. Successful cessation rates range from 10% for telephone-based interventions to 20% for programs that combine intensive counseling and pharmacotherapy. This is comparable internationally. It is difficult to quit smoking. That is why it's called an addiction. But it is not impossible. One story inspired me. Mr. Iskandar shared with me about how he successfully quit smoking, and he also helped his father to quit a 30-year smoking habit. Mr. Iskandar started smoking when he was 14. After smoking for about 8 years, he started his quit journey last year. He wanted to save money for travel and improve himself. He quit cold turkey. He went to the gym and jogged. Mr. Iskandar shared his quit journey with his father, Mr. Muhammad Ibrahim, a smoker of 30 years. Son, motivated father, and his father has also quit smoking. Mr. Iskandar is now working on his brother, Mr. Noor Muhammad, to cut back on smoking. There are learning points from Mr. Iskandar's story. First, personal motivation is important. Studies show that self-motivation and important milestones, such as arrival of a new baby or a serious disease, are critical turning points. Second, supportive family and friends. And third, it is never too late to quit smoking. Mr. Iskandar's father is one example. We will be speaking with more smokers this year to see how we can help. Details will be shared in Healthy SG Task Force recommendations. There are some who have suggested e-cigarettes as smoking cessation aids. Members are aware that we disallowed the importation, sale, distribution, purchase, possession, and use of e-cigarettes since February 2018. Cessation products and programs must first be effective and evidence-based. The current evidence for e-cigarettes as a smoking cessation aid is mixed, and we are monitoring studies that have been conducted. One concern we have is the substitution effect. Some smokers substitute cigarettes with e-cigarettes instead of quitting, or worse, they use both. So it is hardly smoking cessation. It is more like swapping one nicotine tobacco addiction in one guise for another. The other concern is the gateway effect. Various studies have shown that e-cigarette users are more likely to become cigarette smokers compared to non-users. The experience with e-cigarettes in US and Hong Kong are instructive. US Surgeon General has called alarming increase in youth cigarettes use an epidemic. Hong Kong reported a rise in primary 2 to 4 students trying e-cigarettes in the last 2 years, and Hong Kong has recently banned e-cigarettes. We are open to allowing a specific product to be registered and regulated under the Health Products Act as a therapeutic product for smoking cessation. But there must be good evidence and it must be effective. Dr. Chia Shi Lu asked about help for younger smokers. Smoking rate among secondary school, ITE, and polytechnic students dropped from 8% in 2011 to 2019 period to about 4% in 2014 to 2016. But this means that there's still about 12,000 underage smokers. We are focused not only on preventing initiation, but also helping younger smokers quit, and this is our strategy. The Health Sciences Authority has stepped up ground surveillance and enforcement among tobacco retailers to reduce youth access to tobacco. In 2018, HSA suspended the tobacco retail licenses of 23 first-time offender retailers and revoked 4 repeat offenders. Youth smokers are referred to counsellors, quitline or student health advisors at 50 secondary schools, all ITE colleges and polytechnics for cessation counselling. In 2017, 3,000 youths were counselled and 43% managed to reduce smoking and about 10% quit. In June 2018, we launched Better Things to Do, a campaign for youths. We hope to encourage youths to tap on their network to promote a tobacco-free lifestyle. And in January this year, we focus on harmful emerging products, e-cigarettes in particular, which contain nicotine and benzene. And we will intensify our tobacco-free efforts. Mr. Chairman, turning to the third area of my speech, strengthening our health ecosystem, I have 3 points to make. First, growing our healthcare professionals and traditional Chinese medicine practitioners. Second, making screening and follow-up more convenient. And third, the progress on war on diabetes and Healthy SG Task Force. On the first point, Dr. Chia Shi Lu asked about ensuring sufficient numbers of allied health professionals. MOH had worked with MOE and the Singapore Institute of Technology to increase intake of 4 allied health degree programs in physiotherapy, occupational therapy, diagnostic radiography, and radiation therapy from 230 in 2016 to about 300 students in 2018. There are also graduate entry master's programs in speech therapy, clinical psychology, and audiology at the National University of Singapore. MOH regularly reviews our training pipelines. For example, to meet the growing need of dietitians in Singapore, SIT launched the first local 4-year dietetics and nutrition program, degree program. The first cohort will begin the program in September 2019. Earlier this year, we introduced an accelerated professional conversion program for physiotherapists. This program allows mid-career locals with a degree in science-related fields to complete physiotherapist training in less than 3 years, compared to 4. Mr. Christopher D'Souza asked about continuing development and career progression for allied health professionals. We are launching the skills framework for healthcare for 6 professions: nurses, pharmacy technicians, physiotherapists, occupational therapists, speech therapists, and patient service associates. The skills framework for healthcare is a common reference for skills and competencies for different stakeholders. MOH will work closely with the respective professions to identify training needs and build a future-ready healthcare workforce. Turning to traditional Chinese medicine practitioners. To raise professional standards of TCM practitioners, continuing professional education is compulsory when renewing practicing certificates. To defray CPE costs, TCM practitioners can apply for the TCM development grant launched in 2018 at a cap of 200 per year. As of end 2018, we have given more than 70,000 to over 400 TCM practitioners. TCM practitioners can use their Skills Future credit to attend eligible TCM-related courses, and we will continue to work closely with TCM associations to support TCM practitioners. We will make health screening and follow-up more convenient. From May 2019, You can have subsidized checks for blood sugar and cholesterol levels at CHAS clinics without having to fast overnight or for 12 hours. We will update guidelines to recommend the use of glycated hemoglobin or HbA1c and the non-fasting lipid tests as alternative screening tests for diabetes and high blood cholesterol respectively. This has been endorsed by international and local medical professional bodies. A local clinical working group found that the HbA1c, if used correctly, was just as capable as the current tests in detecting diabetes. The group also recommended the use of non-fasting lipid profiles for screening high cholesterol based on international guidelines and studies. The non-fasting tests give Singaporeans a wider range of screening options to choose from. This will be particularly helpful for seniors who are more prone to episodes of low blood sugar. We hope to increase screening uptake with this added convenience. Singaporeans with eye conditions can now receive care closer to their homes. We piloted community eye clinics with Singapore National Eye Centre, Tan Tock Seng Hospital and National University Hospital. And at CECs, patients can have their eyes checked and managed. There are 4 CECs at Punggol Polyclinic, Kiat Hong Family Medicine Clinic, Hougang Polyclinic and Health Promotion Board at Outram. Later this year, there will be 2 more community eye clinics at Pioneer and Geylang Polyclinics. Dr. Lilin Neo asked about promoting healthy lifestyles to prevent chronic diseases and supporting Singaporeans to reduce sugar intake. Mr. Melvin Yong asked for updates on the war on diabetes, and Dr. Chia asked for updates on the Healthy SG Task Force. Healthier eating is now more accessible. As of December 2018, more than 1,200 F&B operators, hawker centres and coffee shops with 8,900 touchpoints island-wide have joined the Healthy Dining Programme. Singaporeans consume 131 million healthier meals in 2018, double that in 2017. Lower sugar beverages are now within reach. We have more drink partners with about 200 outlets as well as drink stores in hawker centres and coffee shops with the Healthy Dining Programme. HPB's Eat, Drink, Shop Healthy campaign nudges Singaporeans to earn points when choosing healthy options during grocery shopping. And we extended the Healthier Ingredient Development Scheme to include sugar-sweetened beverages, desserts and sauces. We partnered 5 dessert suppliers, 3 beverage suppliers and 1 sauce supplier, and there are now healthier options available. Exercise is another area. The National Steps Challenge Season 3 helped 8 in 10 participants who were previously inactive clock more than 150 minutes of physical activity a week. And we're taking another step forward. We are encouraging higher intensity physical activity and hence better fitness. 740,000 participants in Season 4 of the National Steps Challenge were provided with a new step tracker that can measure heart rate. There were also many exercise programs in the community. But there is more to do, and the Healthy SG Task Force, which I chair, which seeks to integrate, coordinate, scale up health promotion efforts across our social and infrastructure agencies and communities, and especially the underreached and disadvantaged groups such as the lower income. Public consultations will start in end March to early May, and we are targeting to release recommendations in the early second half of the year. Mr. Irshad asked about how health promotion efforts have reached our Malay and Indian communities. Let me give an update. Mr. Chairman, with your permission, in Malay please. Usaha kami memupuk masyarakat Melayu sihat bertumpukan kepada 3 aspek. Pertama, jaga makan dan jaga minum. Kedua, aktif secara fizikal. Ketiga, pemeriksaan kesihatan dan rawatan awal. Pelbagai inisiatif telah diperkenalkan tahun ini dan ia telah memberi nafas segar kepada 3 teras tersebut. Kita berbincang pada makanan. Pada tahun 2017, hanya ada 2 makanan halal yang lebih sihat, iaitu healthier choice, di pusat penjajah, iaitu thosai dan mi soto. Kini pilihannya lebih luas dan ada 6 hidangan halal yang lebih sihat. Pilihan healthier choice halal kini termasuk bubur ayam, Penang asam laksa dan mi bakso. Dan hidangan kegemaran ramai seperti biryani, nasi padang, nasi ayam, rendang dan bermacam lauk pauk juga telah diubah suai untuk menjadi lebih sihat. Restoran-restoran Melayu yang terkenal turut serta meluaskan pilihan makanan lazat dan sihat. Rumah Minang, Hajah Maimunah, Sabar Menanti dan berbagai lagi. Dan mereka adalah antara lebih daripada 1,100 kedai makan yang menghidangkan makanan sihat yang halal dan yang lebih sihat. Dan mereka telah menggunakan beras perang, minyak masak sihat, sayuran dan kurang santan. Bukan setakat makan luar sahaja, jika anda ada kenduri atau majlis walimah, juga ada pilihan sihat. Kini ada 107 penyedia makanan catering halal sihat termasuk 24 penyedia majlis perkahwinan Melayu seperti Jamil Catering dan Istana Wedding Services. Maklum balasnya baik, rasa lauk pauk sihat tidak berbeza dan terjejas. Pada bulan Januari tahun ini, kami mulakan kursus Get Fit untuk bakal pengantin di Wedding Fair. 140 bakal pengantin menyertai program perintis ini supaya bila naik pelamin nanti, mereka lebih ringan, lebih ramping dan yang lebih penting, lebih sihat. Kempen kita dah cukup manis dan kurang okey, terutama semasa bulan Ramadan dan Syawal berpesan supaya kurangkan manisan. Di bulan November 2018, saya melancarkan video senaman kurang okey untuk anak prasekolah. Kalau lentur buluh, biarlah dari rebungnya. Dari muda amalkan tabiat baik bersenam dan ia senang dan menggembirakan. 6 sesi perbualan berkongsi mutiara kesihatan telah dianjurkan bersama berita harian. Kalau hendak bersalin, cari bidan. Nasihat pakar itu penting. Justru ini, sesi-sesi seperti ini ialah di mana masyarakat dapat berkongsi petua-petua daripada pakar seperti doktor dari Muslim Healthcare Professionals. Perbincangan tidak setakat itu, malah ia berterusan di ruang maya. Laman media sosial kurang okey yang dimulakan pada Jun 2018 mempunyai lebih daripada 23,000 pengikut dan ruang ini rancak berkongsi resepi sihat dan petua kesihatan. Dan senaman itu penting. Saya terkesan apabila melihat ramai warga emas kita yang sakit-sakit kaki semasa saya menunaikan umrah pada tahun 2017. Bersama dengan HPB dan ejen-ejen umrah, kami melancarkan program Get Fit for Haji and Umrah pada November 2017. Program senaman 6 minggu dianjurkan di masjid dan stadium telah menarik 900 peserta. Dan saya dimaklumkan melalui program ini, jemaah kita lebih ligat bertawaf. Lepas musim umrah, ada program senaman seperti gerak-gelak yang dianjurkan oleh kelab-kelab masyarakat MAC. 4 sesi gerak-gelak telah dianjurkan pada tahun 2018 oleh GRC Tampines, Marine Parade, Sembawang dan minggu lalu di Jurong, di mana kesemuanya telah menarik 2,200 peserta. Sebenarnya jaga kesihatan itu adalah juga seruan agama. Program Jaga Kesihatan Jaga Ummah yang dilancarkan 2 tahun lalu dimulakan dengan 5 masjid dan ia telah menebar sayap kepada 23 masjid dan berbagai program senaman dan bengkel kesihatan dan pemeriksaan kesihatan telah dianjurkan di masjid-masjid JKJU dan telah memberi manfaat kepada lebih daripada 4,500 jemaah di tahun ini. Nikmat kesihatan anugerah tidak ternilai. Marilah kita sama-sama jaga kesihatan keluarga dan diri kita. Let me now turn to the Indian community. I attended a dialogue with 20 Indian voluntary organizations to talk about community health matters and programs. And we are partnering with various Indian groups such as Sri Narayanan Mission, the Central Sikh Temple and Narpani Piravai, the Indian Activity Executive Council committees. We partnered with Surya, Vasantam and various MediaCorp artists to run Family Carnival earlier this January. And over 5,000 people bonded over Zumba and various workouts. We will do more this year. In conclusion, Mr. Chairman, Singaporeans are living longer, and my colleagues and I are working hard to ensure all of us can lead healthy, fulfilling lives. Let us grow healthier together. Let's build a healthy Singapore together. Thank you.
I don't know about you, but I feel very hungry after this speech.